So Harry, what was unique about you was that you had radial keratotomy before, and you had extremely high farsightedness and astigmatism resulting from it. Not only that, your visual quality had gone down, and you're a very avid triathlete, and you're also a very active in a managing post in your work that you do. So the discussions we had at that time, I'm sure you recollect, we had extensive Q&A and the amount you had researched. My desire to take any eye, Harry, like a camera, irrespective of previous surgery, see what's affected and how to best correct the components, given our limitations of that eye. Meaning, the perfect eye for you would be to remove all the RKs and put in a brand new cornea. But that's too invasive a surgery, no promise of great vision at the end. So why not work with what we have to get the best we can with the least intervention? Since your distance and near vision both was very important to you, putting in personal calculations into it and experience, we came up with a lens power that worked ideal for you. Because as you know, with previous RK patients, there's a very high risk of having to exchange the intraocular lens after cataract surgery. Second is my concept that I believe all these patients should then have laser as stage 2, planned stage 2. Where not only do you correct the astigmatism of the RK, but you also can smoothen out the scars. You increase the optical zone, because remember RK was done with a 2 and 3 millimeter zone, so you have a lot of halos at night and stuff. So I believe laser finally gives you that viewfinder despite your RK, that combined with this new intraocular lens, the Restore or any multifocal lens, gives you an excellent visual optics. Now, surely it's not as good as a version eye where we do LASIK, but because those are undisturbed in any way, have no scars, no cuts. But at least in my experience, I have seen that all of you are so appreciative of the vision. And on calculation of the vision, you are 20/20 distance and 20/20 near without glasses. Coming from, I think you were 2700?
700, yes.
I remember right. And today you're here 4 years later, Harry. And again, you are pretty knowledgeable about the procedure. So the questions I have, because I always look at my own work as a skeptic and think, how can I get it better? 1, and 2, am I doing right? So question for you, Harry, on this candid camera conversation, would you do it again?
Oh, absolutely. I'd do it again. I was very frustrated when I did all the research and went to all the other surgeons and they said, well, we can't do that. And I would never let anybody do laser surgery on your eye. No doctor. And when I finally found you, it was like, I can't believe this. He says he can do it, and I read all about you, of course, and you made me ask hundreds of questions, and you asked me a lot of questions, but I had lots because I'd done a lot of research on it. You answered all my questions, and then at the very end, you asked me a couple more and said, well, did you consider this? What's going to happen to the cornea after I do the cataract surgery? And you asked me a few more questions I hadn't thought about. But mostly I asked all the questions I needed, and I was particularly pleased that you wanted to do the Restore lens, because at that point in time, I think the Restore lens was only on the market 15 months or 18 months. It had been approved for 18 months. I thought I was going to have to wrestle with you to make you use that lens, because I didn't want single vision lenses. My vision is very important to me. I need to be able to see that computer monitor. I need to be able to see intermediate ranges. I need to be able to see close-up ranges. I work with detailed spreadsheets, monthly operational reports, weekly operational reports, and I need to be able to do all that. Plus, I ride bicycle. I want to be able to buy a regular pair of sunglasses. Now I can do that. So absolutely I would do it again. And I've recommended a lot of people here. I've sent a lot of people here because I say, if you're going to get done, find the best surgeon, get it done that way. If it costs more, pay it. I don't know if it costs more, but if it does, pay it, because it's worth it. It's worth having someone that can do the complex things, and if there was anything that was to happen, that can deal with the adjustments that would have to be made afterwards.
I really appreciate that, Harry. I've seen a number of patients sent by you. I believe they're all doing fine.
Okay.
Yeah. And another few questions as a scientist, as a surgeon, Harry. What about night vision? People always talk about that. I have not had any of you patients, all of whom in which I've done this with RK, the Restore lens. None of you have complained of night vision. Do you, through this work, do you have any night vision issues?
No, actually, I'm very pleasant surprised, because when I had the RK, I had bright rings at night, circular rings, starbursts coming off every light. It looked like I had a 5-star lens, on my eye, so whenever I saw light, it was just like crosses coming off it. My vision with this method is actually better at night than I can ever remember, even with glasses. It's clearer, it's crisper. Almost, if I want to drive, I almost prefer to drive at night now rather than in the daytime.
That's a great point.
I don't have to deal with bright sunlight or all that stuff. It's clear. It is very, very clear.
Fantastic. So, your advice to people who have RK, Harry, and like you are sitting there, remember RK, the way I approach it, in patients I do only laser, in some patients I do laser with other technology combinations. In your case, I decided to go after the lens as an early cataract because of your very farsightedness. So, to me, it is just a whole spectrum of vision. And like I even told you before, I don't even really care for the name of the surgery and who did it. To me, it's, here is an eyeball, and here's the vision potential, here's the person, look at the whole person. What kind of vision do we want, and what component in this eye do we need to correct to get there? So with that plan, Harry, I've been very pleased with this lens. In fact, I'll be presenting my data at the national meeting, and I appreciate you coming in and sharing your 4-year outcome, because it's also important to show that not only is this vision great immediately after surgery, but it's also consistent long term. And that is important as a teacher to me, because I want people to have honest data and understand why I'm saying that this is doable, and that RK patients need not be miserable sitting there waiting, hoping for something to happen while they can be corrected. So I appreciate that, Harry, and I'm sure you're enjoying your vision. You're getting ready for your bike next.
Yes. You're going to do another bike ride, so
Congratulations.
thank you.
Absolute pleasure.